My name is Brittany, and I've lost 120 pounds with the help of Penn Medicine Princeton Medical Center. Starting at the age around 9 is when I started to gain the weight. It carried on through high school. I tried different programs. I would take 20, 30 pounds off, and then it would just come right back on because I didn't have the willpower to stop eating. 3, 4 breakfasts, 3, 4 lunches, dinners. Like I would just eat big meals 6 times a day. My aunt had bariatric surgery and recommended Dr. Chow.
I remember Brittany very well, and she had a great attitude. She was a younger patient. Also, she had not an excessive amount of weight. Her BMI was about 42, which gives her about 100, 110 pounds over ideal weight. All we do in a sleeve gastrectomy is change the reservoir that people have, their stomach. We don't touch the intestine at all. We don't reroute in any way. We cut and remove roughly 70 to 75% of the stomach. However, if you look at the stomach, there's a lesser curvature or flat side and a greater curvature to the outer side. So this is the portion we remove. This portion out here, 1, have more cells that produce ghrelin or hunger hormone, and 2, tend to be more elastic. What you get is a real significant reduction in food intake. So people are eating about roughly 10 to 20% of what they were previously able to do.
I arrived at Penn Medicine Princeton Medical Center around 6 o'clock in the morning. My procedure was 8 o'clock a.m. I was probably in my room by I'd say 1 o'clock, no later. And 2 hours later, they had me up and walking. I went home the next day before 12 o'clock, as long as I was able to eat and drink what they gave me.
Patients recover very, very quickly. Some patients don't have much discomfort at all. Within a day, they're out of the hospital.
Hi, I'm Donna Post. I work for Penn Medicine Princeton Medical Center. I am the bariatric coordinator, nurse navigator. My favorite part of the job is actually kind of navigating the patient through the journey of weight loss and bariatric surgery.
Donna Post answered all of my questions, brought me through the whole process. We would email back and forth. And even if I had questions 3, 4 months down the road after the bariatric surgery, she still was there to answer all of the questions. Very warm, welcoming, very nurturing.
There's a big psychological component that comes with weight loss and weight loss surgery. 5 years ago, I had the sleeve surgery myself, and it gave me a lot of insight.
I was very prepared when I went home. Donna Post gave me a packet, and it had, everything I was supposed to eat for the first month or 2 after surgery.
And I always tell patients who do the surgery on your stomach, we don't do it up here. And this is the hardest part still 5, 10, 15 years, 20 years later. So part of the program, and I'm really big on that, is that we're addressing those things. And we do it before surgery, because if you try to make all those behavior and lifestyle changes after surgery, it's overwhelming.
People like Brittany that are successful, they are kind of grabbing the bulls by the horn, right? And taking life where they wanted to go. And that I totally accredit to her because it is patient driven.
It's like night and day now to see where she started and where she ended. So she's doing fantastic, and she's excited, and she's exercises a lot now. She said, before I was tired all the time. Now I'm not. I can exercise.
For anyone who is going through a similar weight struggle like I have, I would let them know, go for your dreams. If it's something that you want to do some research and go for it. It's not scary. The recovery is not long at all. You're back to your normal self. And once you do it, you'll feel a million times better about yourself. My goal was 140 pounds, and I've surpassed that to 124. It was definitely a life changer. It's something that I can never forget. It was the best decision that I've made in my life.